Accommodation is the ability to focus different distances, and that occurs because the lens, the natural lens in your eye, changes shape. It loses its ability to change shape over time as we age. If that lens, which is initially crystal clear, starts getting cloudy, that cloudy lens is what is called a cataract. So cataract is a clouded lens in the eye. Cataracts can develop really almost at any time in your life. Oftentimes they can develop as early as in your 40s, and when they initially develop, they can cause changes in your prescription and in your refraction over time. Traditionally with cataract surgery, we would remove that clouded lens and replace it with a nice clear intraocular lens. And the idea traditionally with cataract surgery was to take somebody's vision that was poor because of the cataract and clear it up. That meant that their vision would be significantly better with glasses, with a correction. Now we can take it one step further. We can not only remove that cataract and give good vision with glasses, but we can remove the cloudy cataract and give excellent vision without glasses, both at distance and near. There are multiple new exciting lenses. Not any lens is perfect for every patient. So I spend a lot of time with each patient finding out what their visual needs are and their desires after surgery, and tailor-make the lens decision based upon the individual patient. One of the lenses that I'm using is a wavefront correcting lens that corrects some of the higher order aberrations in the eye, similar to what we do with high definition LASIK. And those lenses work great in a lot of patients. They work wonderfully to reduce the aberrations, but they are what we call a monofocal lens, so they're still focused at one distance. But in many patients that lens works very well, and it improves their vision and significantly, like with night driving and various activities. Then I'm also using multifocal lenses that allow you to see both distance and near. Now there are basically two types of multifocal lenses. One is what's called an accommodating lens. And that lens I put in the eye, and it actually has a hinge, a couple of hinges on the lens, and the lens physically moves within the eye. So that when you're looking in the distance, the lens is in one position, and when you try to look up close, that lens moves forward in your eye and allows you to focus up close. You look off in the distance again, and the lens moves back to give you the distance vision. So that's how that lens works to give you both distance and near. There are other lenses, there are a couple other lenses out available now, and there probably will be more soon, that are multifocal lenses that are stationary multifocal lenses. These lenses I put in the eye and they stay in the position that I put them in. However, they have multiple concentric rings in the lens, and that allows you to get multiple vision through these concentric rings. So you get simultaneous multiple vision, so that when you're looking in the distance, the light is split between distance and near, and your brain focuses on the distance image and ignores the near image. When you look up close, the multiple images you get, you have a clear near image, and the brain ignores the distance image. So it gives you good simultaneous distance and near vision. Both these types of multifocal lenses are designed to give you the ability to see both distance and near like you did when you were younger without glasses. They just achieve this goal in different ways. And again, not every lens is right for every patient, and I sit down and discuss with each patient the pros and cons of each lens and decide which lens is best for you. The goal with these new deluxe lenses is to allow you to function almost all the time, possibly all the time, but more importantly, to significantly decrease your dependency on glasses, so that I can't guarantee that you'll never wear glasses again, but I can almost guarantee that most of the time, with most of your functioning, you'll be able to get by without glasses. You may find for a few activities you need glasses, but most patients don't even need that. For patients who have cataracts, I perform the surgery at the Sharp Outpatient Pavilion. Sharp Hospital here in San Diego has recently built this new outpatient pavilion, which is a beautiful facility. The nice thing about it is the nurses that work there have worked with me for over 20 years, and we have 4 operating rooms in the facility that are dedicated just to eye surgery. So it gives you, the patient, the best chance of getting the best result. There is no institution in town that performs more eye surgery than is done there at the Sharp Outpatient Pavilion. And I'm very comfortable taking my patients to that facility. It's truly an exciting time for patients who have cataracts and need cataract surgery. Traditionally, you would have your surgery, have a lens implant put in, and get your new glasses. Now you have an option as a patient, whether you're a Medicare patient or other insurance, to pay an additional fee to get an option of getting excellent vision without glasses, not only in the distance, but possibly distance and near. And with using these new techniques that we have and these new lenses, well over 80 to 90% of my patients who opt for this are seeing well without glasses, and that's at any distance.